Okay, so we're live. So
Great.
hi, good day everyone. So again, we're doing this again. That's the thing with technology, in this pandemic that we're living in. It takes a lot of getting used to and adjusting. So the Justice for Women Foundation has decided that in this time when we're dealing with a pandemic and when we're dealing with so much changes that we didn't really cater for or expect, that we want to commemorate this month, the month of May, which is Maternal Mental Health Month. And seeing that we are all about justice for women, we found it fitting and we were fortunate to have one of our very own, Ms. Rochelle Mohammed, with us. She's a executive member of the Justice for Women Foundation, so we are really excited to have her. So today she's going to be presenting to you all, and I'm so excited. Rochelle, take it over.
Good evening, everyone. Pleasure to be here again. As Atia said, I'm one of the exec members for the Justice for Women Foundation and part of our four-part series on mental health issues or awareness. We would be tackling today and covering all parts of it as much as we can. Um, what is maternal mental health? Maternal mental health is, in terms of a definition, it is the status or condition of a mother's mental, emotional, and psychological well-being during pregnancy and after pregnancy. Several issues could arise after pregnancy, which would cover uh, most common postpartum depressions, or what we call what we call baby blues. Now, postpartum depression carries four areas: postpartum blues, and as I go along, I will explain the symptoms, the onsets, and whether or not how intense it would be in terms of seeking clinical treatment. Postpartum blues, it does not require clinical treatment, but it does require some measure of attention. Postpartum blues symptoms are basically irritability, fatigue, some small measure of anxiety, tearfulness. This usually comes on within 2 to 3 weeks after having um, or giving birth to a baby, and over time, without it prolonging, it sorts itself out in a short period of time. The second one would be difficult postpartum or adjustment stress. Difficult postpartum is an extension of postpartum blues, better known as baby blues. There's a feeling of doubt, overwhelm, some measure of frustration, and it means that you have to employ yourself a little bit harder to get yourself out of that state. It does not require extensive um, clinical interventions, but if it prolongs, it will lead to what we call postpartum depression or anxiety. And there's where the symptoms become a bit more apparent and it becomes long term. Some people go, depending on the condition that you're in mentally and emotionally, some people could go for a period of 6 months, 7 months, some people even go more than a year with it. So the symptoms for that is feeling of inefficiencies, despair, extreme anxiety, intense mood changes. Now, intense mood changes could lead to hallucinations. It could lead to what we call postpartum rage, and it extends not just to the person themselves, the mother herself, but it could extend to baby and who else is within her presence if not managed properly. Postpartum depression requires clinical intervention. When I say clinical interventions, I mean at some point you would have to get counseling depending on your hormone levels, because in postpartum depression, there's a significant drop in a woman's hormone levels then. So it would require some measure of clinical treatment. The onset of this comes along right after birth, and again, it could go like postpartum stress. It can go for a long period of time if not managed properly. Postpartum psychosis, this one requires hospitalization to the point where you become a threat to yourself, you become a threat to your baby and any person around you. This is where the mother becomes out of touch with the reality of her situation, being a mother. Um, there's heightened levels of hallucination, delusions, agitation, confusion. Now, this takes not just a mental toll, but an emotional toll and a physical toll because the mother now is in a state where she can cause harm to herself, she can cause harm to the baby and anyone else within her fold. Um, Causes of these, like I would have said before, is drastic changes in body hormones and first signs and symptoms of it normally starts 2 to 3 weeks after. Some people experience it before. If they would have had prior issues with depression, they would have experienced it before the 2 week interval, like maybe just days after. But normally it starts like 2 to 3 weeks after giving birth. What can a mother do in the event that she thinks that she's coming on, because it doesn't start with postpartum psychosis all at once. There's a lead up, a build up of emotions and a build up of the symptoms that leads to postpartum psychosis. So if at some point in the early stages a mother is in tune with herself and she is able to recognize the symptoms, what can she do? I like to use the acronym NEST. NEST as in NEST. NEST nutrition. Nutrition is what you feed your body. A healthy body would really go towards contributing to a healthy mind. Eat properly, pay particular attention to your nutrition, your diet, healthy meals. It would mean that your body is getting sufficient amount of nutrients at a time where it's giving more than what it would have usually been doing before, because you're not just self-sustaining, but you're sustaining yourself and a child as well. The E in NEST stands for exercise. Now, right after birth, most women can't do anything to the extreme in terms of exercises, especially if you would have had a C-section and all of that. It would put you in a difficult position to go to the extent of what your normal exercise regime is. So I like to suggest try meditation, try yoga, find a balance that would work for you in that area. The reason why exercise is because it stimulates your mental and sort of puts you into a different zone of self-care. Um, S in nest, it's for sleep and rest. I suggest to mothers, and my sister would tell you this when she had my nephews, sleep when baby's sleeping. Do as much of that as you can, and once your body is relaxed, your body is rested, you tend to be able. Now, I know it's difficult because some babies are a bit more to deal with than others. Some wait for extended period of time and all of that. But try to develop a pattern, try to develop a routine where when baby's asleep, you're asleep as well. So you get that measure of relaxation. The T in nest, um, it stands for time. Now, it's a bit difficult having a new baby to find time for yourself. So, I suggest for 10 minutes, just 10 minutes of every day after baby comes, whether it's the 10 minutes you take to shower or the 10 minutes you take to eat. Use that time to reflect on you. Use that time to mentally assess yourself. And if in that time you have trouble with what it is you recognize with yourself, then you look for support. Talk to your partner, talk to people who is around you. If at some point in time you feel after that evaluation, and try to do it every day because emotions change rapidly, situations change rapidly. If at any given point in time you think that you're overwhelmed and it's too much for you to handle, then reach out to somebody. Reach out to your partner, reach out to a parent. Most women tend to gravitate towards their mothers or an elder sister or an aunt, somebody who have experience with children, somebody who would have given birth already and know what the common factors are in terms of dealing with things like managing baby's time, managing your time, and all of that. So, yes, that is the suggestions for self care. Now, we pay a lot of attention to the maternal factors of postpartum depression, and very rare you hear about postpartum depression affecting men or fathers. And I want to put some emphasis on that today. There are men, and I know a couple, who would have experienced postpartum depression. Now, it's a little bit more difficult to identify with because, as we know, men aren't very forthcoming with their feelings. Men don't like to present themselves in a vulnerable light. So at some point in time, it would be imperative if you notice your partner, your male partner, that is moving a bit differently during the time of pregnancy and after baby come. If you notice mood swing changes, if you notice that he's less involved with the baby and yourself, if you notice that his aggression level arises, you must be able to identify those things and sit down with him, have a chat with him, talk with him, try to get him to be open about it. Now, other than a new baby in the family, given the timeline that we're in right now in terms of the pandemic, a lot of people have been losing jobs. And that in itself is a stress factor. It is something else that a man has to consider when there's a baby in the midst of it. How is he going to provide for his family? How is he going to provide for this newborn child? How is he going to maintain all the commitments that he would have had prior to baby coming and an additional commitment now that baby is here? And that in itself is an added stress level. So while it affects women in terms of the psychological factors and the emotional factors, it do affect men mentally and to some point emotionally as well. So that's something we would want to consider. And like I said, it's a little bit more difficult to identify in men because men aren't very open or like to be placed in a vulnerable position where they have to explain themselves or they have to tell how they feel about a particular instance. Um, treatment treatment methods for men, it's usually talk therapy. And again, this is something difficult for men to do, but thus far, that is the only treatment in terms of talk therapy for men. For women, um, during your antenatal clinic, I know when I used to work at the hospital, they used to do this often in the antenatal clinics. I am not sure if they still do it now, but from time to time, they bring in a psychologist or a counselor to liaise with pregnant women and find out, well, how you're dealing with pregnancy, what are your thoughts surrounding it, and if you were to have any concerns, and they assess your situation to try to rule out whether or not you may be a potential, um, you may have the potential to develop postpartum depression. So that is one aspect of it. If for some reason you didn't have any um, known factors or any known symptoms then, and it only came thereabout after your pregnancy or after you giving birth, sorry, you can go back to your antenatal clinic and they will put you on to the Family Planning Association network within your clinic area. And in that clinic, the family planning clinic, you're supposed to be provided with some measure of counseling. If, however, you choose not to do that, there is a body called the Trinidad and Tobago Association of Psychologists. Right now, they have several psychologists that are offering counseling um, within a specific period of time during the course of the day. After this session, I will post one of their flyers to the group's wall, and if need be, you can share it or keep it for your own reference if that may work for you. There's also the Ministry of Social Development, and they offer counseling sessions as well. Um, One has to remember in the counseling field, the first rule is we can't help you unless you want help. And you have to employ that part of it upon yourself. There's no shame, there's no blame in being vulnerable in a time like this. And mental health and how you approach your personal mental health will determine the quality of life that you have and the people that are within your fold, the quality of life that they will have as well. Because postpartum depression, a lot of people tend to think that it only affects mothers, and it doesn't. It affects mothers, it affects fathers, and it affects the children. You may ask, how does postpartum depression affect children? Postpartum depression affects children in the sense that if it goes untreated, remember your mother is the person that a child is constantly in contact with. So if it's left untreated, it gets to the point where it contributes to the child's well-being, in the sense that the child may not receive all the attention, or the attention that the child may be receiving isn't coming from a place of genuine nurturing and genuine care. Maybe mother is just doing what she has to do because she know that is what she needs to do, but there isn't any emotions and any genuine feelings employed into how she's dealing with baby. How does this affect the child growing up? um, Children are sensitive and they tend to feed off of vibrations, they tend to feed off of emotions and how you interact with them. So at some point in time, as the child were to grow up, um, even before reaching toddler stage or as a young adult, you would notice temper tantrums. You would notice things like sleeping disorder in younger children. You will notice things like hyperactivity, delay in speech. You may ask, how does that affect delay in speech? If a mother isn't interacting with her child on a verbal level, or she's interacting with her child from a place of anger and resentment, this puts the child into a psychological disadvantage where the child's emotions are affected negatively. So, and there's a host of other different negative effects that it have on children, but it's too much to go into, and it's something that you have to treat case by case because every child is different, every situation is different. But the common factor is unless you get the help that you need, there's very little that we could do to force you. So you have to employ it on yourself to get that help, to want that help, and we will take it from there, give you the best that we can in terms of counseling so that it does not create a ripple effect. Um, it comes down to postpartum depression comes down to not just the mental aspect of it, but the emotional aspect of it. So you can put yourself in two places. Emotionally, doing a self assessment will tell you you have to be in touch with yourself. Psychologically, it will require the intervention of a psychologist to get you to that point. So, again, if it is that you think that you have the symptoms or you're just not sure about it, reach out to someone in the field and ask. Atia, Atia,
Hi, my dear. I was in the
yes.
back here taking notes.
Oh,
Okay, so
so yes,
Rochelle.
that
So I
sorts of wrapped it up a little bit for postpartum depression.
mhm,
Of course, I know that you'd have questions. So,
of course. So I think for me, and
mhm.
I do want to invite persons to please drop your questions in the comment. If you all have any questions that you all want answered while I'm speaking with Rochelle, feel free to do that. So I think that especially for mothers that for women like first time pregnancy, like that might be
Mhm.
something that's really scary because you don't know what to expect really. And a lot of times you don't really have, now we take it for granted that everyone has the guidance from someone who would have gone through it or whatever. But not everyone is privileged to have that, you know. So I'm really happy that you mentioned during your clinic the resources that are available. And that's one of the things that resources are there, but I think a lot of the times we don't know where to reach out to, who to reach out to kind of, you know, tap into these resources that are already there for us. So I have a question. I know that as women, we tend to be, we nurturers and we give more of ourselves all of the time. And somehow we feel as though not giving of ourselves means that we're selfish or whatever. You know, that self care that you spoke about, and you did give some tips or whatever. But sometimes you have your partner, and there are others that are single mothers and are going through this on their own. So what advice could you give now to a single mother who doesn't have the support of a partner but has to, you know, learn how to maneuver motherhood?
In her case, it would be because most women tend to gravitate towards their partner in a situation like that. In the case of a single mother, find a support system. If you can't find one, build one. You have to be aggressive with your own healthcare regime, with
Right.
whether it's physically, mentally, or emotionally. Employ it upon yourself that this is where I am, this is the resources that I don't have, but this is the resources I am going to create for myself. No person is an island by themselves. There's always somebody that they know.
Yeah.
So, single mother would have girlfriends, she will have a sister, she may have an aunt, a grandmother. Take the initiative to say, here what? I already going through this on my own. Baby daddy decide he don't want to be part of it, or maybe an unfortunate circumstances and he's no longer part of this world, but I have to go through it because baby is dependent on my physical well-being, but more importantly, my mental well-being to carry him or her through to being a better adult. So employer relations,
Mm-hmm.
talk to somebody, reach out to somebody. Now, somebody told me this a couple of days ago, and this is a pregnant woman actually, and she said, "Well, if I could bring a child into this world by myself, I don't need anybody else." And I am saying it takes a village. We always hear our parents say this. It takes a village to raise a child, but it takes a village to also support a child's mother. A
Yeah.
simple over the fence chat does make a big difference.
Yeah.
A simple WhatsApp. And the nice part about it now is that there are so many groups to get involved in.
Yeah.
There are so many initiatives going on now. So take it upon yourself. You may be in the physical situation alone, but think outside that you're not alone. There is help available out there. There are people that you could interact with. There are people that you could build networking with and get the help that you need. You may very well find godmothers and godfathers in those circles.
Yeah,
Yes.
definitely. And I think it was interesting that you touched on the fact that it does affect fathers. Now, that is something that I did not know. So when you said it, I was like, whoa. And the reason why I felt like, that was so interesting to learn because men are very locked away from their emotions.
Yes.
So as a mother, and you observe, okay, my partner is going through postpartum. How do I now encourage my partner to get the help that he needs, even if it's just a chat, because men don't like to chat? So what can I now do?
So I the same person that I would have had this conversation with last week, she would have noticed it in one of her girlfriends that is pregnant, and that person's partner, baby isn't here as yet, but he's under a lot of stress because of the current situation that we're in with regards to the pandemic, financial restraints, and all of that. How do you get through to a person that what I just call men the male walls? Because it's very hard to break through to them, especially because they're very much guarded and they tend to think that if I don't say anything, it will just pass by. And then you start to see the ripple effect in their behavior.
Yeah,
Pillow talk. Pillow talk tend to do a lot more than what we think it should be doing. So get him to talk during the course of the day, or maybe on work. I always tell women, don't call your significant other on work to vent. Don't call them to get in touch with their feelings on work. Don't do that because it's an added stress factor, one, and the commute from home to work, a lot of things could happen and you may say something in the moment, or they may say something in the moment that you may very well regret. So it's something that you could avoid and avoid.
yeah,
Pillow talk tends to get men in a position when I'm not saying this for men to realize that it's what we use to get to them, but I'm saying this so that women understand where it's more effective to get a man to open up.
right.
And it starts with the little things. Start before baby come, because that's before all that you would start to notice symptoms. You would start to notice signs that he's going through a rough time.
Yeah,
He may be all jolly about it, but get him involved in the decision making. Most women don't allow men to choose baby names, and that is a big thing. Get him to do the baby name. Would you ask about? Gender reveal is now a big thing now. Get him involved. And once he feels that he is involved, he will start to be a little bit more loose, a little bit more verbal with his communications with how this situation or the event of baby is affected him. If you
Yeah.
notice that it starts to go down a particular road where you feel that he's not opening up to you, but you're pretty sure that there's something wrong, then get the expertise involved.
Yeah, yeah. And I think it was really interesting that you talk about dealing with the pandemic and pregnancy because at this moment we are in a pandemic, and even worse, we are in a lockdown. And what that means is that persons are losing jobs, and it's something that we're not talking about. And not just that we're not talking about, is like if it doesn't affect you directly, somehow we tend to kind of, we don't like to live in the reality of what is happening. So we shut things out and we try to pretend it's not happening. But the reality is that persons are losing jobs. Families, it's more difficult for persons to support their families because where two individuals was working, now you have children at home. So you might have a
Mhm.
mother now that has to balance um, being home home with the children so that they could do school, and then having to provide, and it's a lot. And some women, they don't even have the choice because they are single mothers, so now they have to balance going to work, making sure that the children get the work done. Even on work, I observe it. There are persons on work, you'll see them on the phone. You do your work, the teacher finish your work, and all of this is stress in itself, and finding that balance. So my question is, what can I, as a mother, not necessarily a single mother, but as a mother, do now to cope with just finding that balance with work, with the struggles that I may be going through in my personal relationship, because my husband may have lost his job due to the pandemic, the industry closed down, or whatever. What do I do as a woman?
As you say, it's a difficult time that we're in, and finding workable solutions is a little bit hard because you have to play it as it happens. No
Yeah.
one fixes an entire fix for a situation. So I would say this to mothers with who are single mothers, that is with very little support system, find a routine that works for you. Sit down with your children if they're at age where you could communicate effectively with them. Make them part of the decision, make them part of the solution. And that is what most parents aren't doing now. They just develop a routine and they drop it on the children. This is how we're going to do it, and this is how it's going to be done. And they don't ask the child how they feel about it. Now, you're not asking for your child's approval,
Yeah.
but you're asking your child so that you inject that sense of responsibility, that they understand what your responsibility is, and they are to help you help them. So firstly, sit down with your children. I mean,
Hmm.
parents who have toddlers, they will have to have external people to help with this situation because you can't leave baby alone at home.
You're right.
So it might be a family member or a private babysitter.
And I think daycares are now closed, so that's the
Yes,
other part of it. You don't even
so
have that
more,
support.
more people are relying on family members to help the situation.
Right.
If you have toddlers, that would work. If you have older children and you have to leave them home, whether it's with the supervision of another adult, remember this is firstly your responsibility. Your children are your
Hmm.
responsibility. Sit down with them before you develop your routine. Converse with them. Let them know this is how you have to deal with your work schedule, and you're asking them to help you along the way. Once you
Right.
start to employ these things on children and they start to understand the concepts behind it and they understand how much of it, and we tend to downplay how much children understand.
Yeah, yeah.
And yeah, they would be able to wrap their minds around it, and you would notice that you have more help. You wouldn't feel that you just have to do it on your own.
Definitely.
If for some reason that works for you, keep revisiting it at least maybe once a week, twice a week, because situations change. When you get home in the evening, I know it could be overwhelming, but take at least 10, 15 minutes. Sit down with them. You weren't with them for the entire day. Find out what went on with them during the course of the day
Yeah.
so that you know how to tweak your little schedules, how to tweak the way you approach certain things with them. Before you go to bed, take some time. And I say this all the time, even if you're not a parent, you don't have children, do it for yourself. Take at least nothing less than 30 minutes.
Yeah.
Don't pray about it because prayer is asking. Don't just zone out, but sit down every day. If you can't do it every day, every other day. But I implore you to do it every day. Ask
Yeah.
yourself what you're feeling, how you're feeling, and what you could do for yourself in a personal capacity to subside those feelings, better those feelings, improve those feelings. And if you can't do it for yourself, what are your available resources to help you to get to that point?
Yeah.
You have, I always say this, you have to remember your mental health is your responsibility.
Definitely.
There's only so much counselors and psychologists and psychotherapists could help you with. But your mental and emotional health is your responsibility. How you
Mhm.
choose to tackle that will determine the quality of life you have and those around
Yes, definitely. And before we move on, I just want to tap into some of the comments that I'm getting. Someone said thank you for the live. Someone else said they're loving the live, and we have a comment here. Yes, facts. No matter how hard you have to make some time for them because I am a mother of a 6 month old and a 9 year old, and having to manage online schooling and baby, it's hard. But I still try. It's just to watch a cartoon with the 9 year old. You have to ease, you have to, else they'll feel alone. And that is so true. Just making, and I think it's so nice to have an actual mother that's actually dealing with it, actually going through it. I'm here to attest to what it is you're saying. My next question is, because I've seen this a lot,
you. Mm-hmm.
even now in the foundation, we've offered counseling to individuals and all of that. And some of the feedback is that, people tend to not want counseling because they equate counseling to act crazy. Or people would think, well, you're mad. Or, I don't know if it's a cultural thing, but somehow we think that getting counseling means we mentally unstable, we crazy, and so we don't want to be that, so we rather just ignore it. What advice could you give?
Anytime people hear the term mental health, they tend to make it a taboo subject. They tend to think that once you say mental health or mental illness, that you're crazy. You belong to the
Yeah,
Lutheran.
yeah,
Anytime you hear psychiatrist, that takes them in a different direction as well. Once they start to
yeah,
understand what the term psychiatrist means or psychologist or psychotherapist, it takes them into a whole different thing.
yeah,
However, I want to say this mental health is not something to frown upon.
yeah,
It is not something to stigmatize others or yourself with. We can treat outwardly a cut, we could treat a broken arm, we could treat any outward physical damage with your approvals and maybe otherwise as well if it comes down to that. We cannot treat what's going on in your head unless you decide to subject yourself to wanting help. There is no shame, there's no blame. There is nothing wrong in reaching out for help.
Yeah.
One thing that I want to let people know as well, what you say to your psychologist, what you say to your therapist, what you say to your counselor is always treated in the strictest of confidence.
Yeah.
Nothing unless, and I want to make this really, really, really clear, unless we realize that what you're saying to us puts another person in danger or a crime that you would have committed, we are obligated by the laws of the land to make the relevant authorities aware of it because it comes as though we're aiding and abetting. But there's a process before you even get to that. So don't be too alarmed about it.
So if I commit
Um,
a crime, don't go to a counselor.
no, I'm not saying don't go to a council. I am saying that you have to remember if you commit the crime and you were to give us the information of how the crime was committed, who was your victim, why you commit the crime, we are obligated to give the
Yeah.
authorities that information for your well-being, for the well-being of your victim as well. However, before we get to that point, we don't just turn you over to the authorities. There's a process that happens. It's not like you come and you sit down in front of me and you say, "Here, what you shall I killed somebody yesterday," and and I call the authorities one time. No, that's not how it happens.
Right.
Um, there's a process before it gets there. And before we get to that point, we make sure that you're mentally and emotionally aware of what is going to happen and we prep you for the steps to come. So we don't just leave you out to the authorities to do whatever they have to do. We mentally prepare you. We try to give you all the notes that would come with it, all the information that you would need. And we still continue to provide that measure of support. So you don't lose us when you
Yeah.
get to that point.
Right.
We still provide you with that measure of counseling and support.
Yeah.
So again, counseling is never a bad thing. What a lot of people don't know is that when you start counseling, you learn a lot of yourself that you don't know,
Yeah.
right? And I, I like to think that if someone else talking to someone else could make me realize something about myself that I don't know about, and that person is able to help me, then that is a plus for me
Mm.
because then I'm better able not just to help myself, but to probably share light to somebody else that may have had or having the same issues and they're not aware of it.
Yeah.
So,
Yeah.
for the persons that listening on, um, don't think of counseling as a bad thing. It is not actually. Counseling is self empowering yourself to better yourself, understanding your triggers, your traits, your emotions, your psychological factors that would affect you. It is a plus and it is not something that should be stigmatized against. It is not a taboo subject. It is not something wrong.
Yeah. Yeah. Um, so I'm still opening if anyone has any questions that they would like to ask. But in the meantime, I would like to just reiterate that we do have counseling available to persons who feel as though they want to speak to a professional counselor personally about things that are affecting them. Mental health is a real thing, and I think it was so interesting that you mentioned, that self care, spending time with yourself, introspection, journaling, find things to do that brings you happiness, that lets you get to know yourself a little better.
And that's the
So,
thing, once you
mhm,
start doing it, you realize that you're not just making it something to do, but you start to make it a routine. And it starts to become part of you. and you start to
Yeah.
understand how much of your self-worth goes into this.
Yeah.
A simple thing, go in the supermarket and buy a scented, if it's just one scented candle, come
Yeah.
home. It doesn't even have to be a scented candle, but just
Yeah.
one little candle. Come home with it. You live by yourself or you live with someone, you go to the bathroom if you live with other people and you don't have that level of privacy, you go to the bathroom and before you shower, you just light that candle, take off the light, and put yourself in that nice solitude place. Sometimes candles, for me, that works for me. Sometimes that may not work for somebody else, but the mere fact of just sitting in a quiet zone and listening to some music or some motivational clips, that helps with that as well. With others, it's self affirmations. With
Yeah.
somebody else, it's journaling. So take the initiative to do it for yourself. We
Yeah.
pay tens of thousands of dollars in psychotherapy and talking to our psychologist. But if you start, and I'm not saying that that is bad, I am saying that if you need the help is there, and you should employ yourself to get it. But you
Yeah.
could do certain things for yourself, little things that make a huge difference at the end of the day. But you have to want to do it for yourself.
Yeah. Yeah. Rochelle, it was so I'm seeing in the comments. Thanks so much. Very informative. Thanks. That's why I'm seeing about my well-being. Hope more person make that move. So I'm seeing the comments and I'm realizing that discussions like this is so important. It's important for us personally. It's important for the community. It's important our initiative. It's just important. And a lot of times, we tend to ignore these important topics because somehow it's taboo to us. So I just want to say thank you so much to Rochelle for making this time to come on here for the next 4 Saturdays. This is one Saturday down. We have three more to go. And we should be touching on different topics. And listen, you don't want to miss it. Share the live. Let persons, just as much as it was helpful to you, let it be helpful to someone else. Thank you again so much, Rochelle. And
But then
enjoy the rest of your weekend, everybody.
I take
Bye.
care, everyone.